Hula-hula lang.
Try, Doc. Try lang.
Sige, go ahead. Huwag mahihiya. So, nag-open notes ka pa.
Ano, Doc? May question ka, Doc.
Hindi nyo narinig? How can you explain the low flow, low velocity environment in the capillaries?
Patay.
Mahirap.
Outro daw, Dok, medyo choppy kasi.
I'm sorry. How can you explain the low flow, low velocity environment in the capillaries?
Because the capillaries, Doc, is the area where the exchange of oxygen and carbon dioxide and nutrients occur.
Pero bakit siya nagiging ganun?
Haluag, Dok, iti cross-sectional surface area.
Right. You are correct. Dane Michael Timbal. According to the volume flow rate, velocity is directly proportional to flow, but inversely proportional to cross-sectional area. Therefore, if the cross-sectional area will increase, the velocity and the flow will also decrease. Since capillaries has the largest cross-sectional area, the velocity and the flow declines. Oh, correct yan. Next question. How can you explain that the veins can contain large volume of blood, but at low pressure?
It is more elastic.
I agree to that. Can you
It is wider, Doc. The lumen is wider.
You're correct. Yes, you're correct. But can you use some? Yes. What about capacitance?
Capacitance, Doc, is with the formula in the book. It is defined as volume per unit of pressure. Since in the veins there is a low pressure, it means that it could accommodate a larger amount of volume.
Okay. Parang capacitance is directly proportional to volume, but inversely proportional to pressure. And so if there is if the capacitance, if the volume increases, the capacitance increases and the pressure declines. Kasi inversely proportional si capacitance at si pressure. So if there's an increase in capacitance, there is a decline in pressure. If the capacitance will decrease, then the pressure will rise. Okay? Isa pa?
Yes, Doc.
How can you explain the mechanism by which, let's say, inotropes like norepinephrine or dopamine can increase the blood pressure?
Because they act as vasoconstrictors.
Right. So what happens? How can it increase the blood pressure?
They reduce the size of the lumen.
Yes, you're correct. What else? You expound further. Increase the beat.
It triggers the alpha receptors.
Yes, it triggers the alpha receptors, causing vasoconstriction, causing a decrease in the lumen or the size of the artery.
Triggering the sympathetic nervous system effect.
Therefore, the norepinephrine triggers sympathetic via alpha, causing vasoconstriction, causing decrease in artery size. So you connect
relationship of resistance and radius.
Right. Paano yon?
With the use of the Poiseuille's equation. Since during vasoconstriction, the lumen is
decreased.
The lumen of the blood vessels are reduced. It means that the radius is reduced. When the radius is reduced, the resistance is increased.
Correct. So paano ngayon yan? If the resistance will increase, how do you connect?
During resistance, if the pressure,
yes, the BP, how can it increase the blood pressure? Nag-increase yung resistance mo, correct yun.
Since the resistance is increased, the blood flow connection with the flow formula, since the resistance is increased, flow is decreased.
Mhm.
When flow is decreased, there is a connotation that the pressure inside the vessels are increased. Oh,
Eh, Kasi flow is direct
say,
to pressure eh.
of,
Diba? But inversely proportional to resistance. So the resistance increase, the flow decrease, the pressure decrease. So paano na yan? How can you connect that to an increase in BP? Correct.
Document resistance. Meaning guti ay man ang vessel.
Yes, yes.
Guti ay nalaan blood flow nga maagi. So para ma-compensate an kuan an guti ay nga blood flow na maagi an heart mapampihin mas makusog asya ma-increase ang BP. Amo ba?
Pwede, pero I'm looking for more.
Conductance, Doc.
The inhibition of sympathetic activity.
No, there is activation actually. There is, if you give norepinephrine or dopamine, you stimulate further sympathetic activity. Malapit na yon. There was a connection to vasoconstriction, a decrease in arterial size, and then an increase in resistance. Tumaas yung resistance. Now let's connect that to an increase in BP. Paano nag-increase ng BP? Baka may nag-text, hindi ko nakikita. Chat, hindi ko nakikita. Yes! Meron sumagot dito. Queenie, bakit di ka nagsasalita? Dali. Correct yun, Queenie.
Sasalita sila do.
Go,
BP
go.
equals cardiac output times total peripheral resistance. By decreasing the radius from the equation of the Pusill's law. If increasing radius, it's to the fourth power, so mag-increase yung resistance, therefore mag-increase yung BP.
Correct. Correct. You are correct. Tama yun. So yun yung connect ha. You will not use Ohm's law to connect to the rise in BP, but you will connect that to the formula of blood pressure, which is cardiac output times total peripheral resistance. So a rise in total peripheral resistance means an increase in blood pressure, provided that the cardiac output will remain the same. Kasi pag yung cardiac output mag-decline kahit mataas si total peripheral resistance, the BP will not increase. Did you get me? Kasi dalawa yung factor sa formula ng BP, cardiac output and total peripheral resistance. In fact, cardiac output is also composed of stroke volume and heart rate. And so if the heart rate declines, even if the total peripheral resistance is increased, baka same lang yung BP. Okay? Hindi siya tataas yung BP. So in the same manner, if the stroke volume will also decline, even if there is an increase in total peripheral resistance, baka same lang si BP or hindi siya nag-increase. So for the BP to rise, the factors should override the other. For example, the cardiac output should increase even if the total peripheral resistance remains the same or decreases. In the same manner, the total peripheral resistance should rise if the cardiac output declines. That's how you increase the BP. I like that. Oh, one more question. Okay lang?
Yes, Doc, more.
Yes, Doc, kay mali pong gyapit pag pag-connect sa book.
Parang pagbabasahin mo kasi siya, alam mo lang na ganun yung formula, but sa exam kasi hindi naman tayo, give to me the formula of capacitance. Hindi naman ganun ang question, no?
Sugaran na Doc.
Hindi pwede. Walang ganun sa board exam eh. Sa board exam kasi is, yung thought process yung kukunin nyo eh, hindi memorization. It's the thought process. So, hindi naman tayo. Number 1, what is the formula of capacitance? Sasabihin nyo, C is equal to volume over pressure. Hindi ganun yun eh. Parang ano siya eh, sentence siya, and then how you analyze. Next question. How can you explain the decline or
Doc, nawara ka, Doc.
Doc. Doc, choppy ka po.
Choppy talaga to.
Choppy ka, Doc.
Kasi
Dok. Dok, lumaban ka, Dok. Dok, negative.
Okay na?
Wala talaga
Are we-
kami nabatian.
Waray, Doc.
Doc, nag-stroke ka ni Monet.
Globe, have mercy. Pwede magdasal muna tayo. Father God, please give us a good Wi-Fi, a good internet, and thank you for this wonderful day. I pray that we will learn something new. Give my students the knowledge and wisdom that they will need in order to prepare them once they treat their patients. Thank you and good morning. Narinig niyo? Hindi.
Yes, Doc. Okay na, Doc.
Yes po, Doc.
Yes. The question is, final question, top 3 Miss Universe. Ganito ang question, no? How can you explain the decline or drop of pressure in the arterials?
Shit.
Thank you for that wonderful question. And for that, I declare myself 4th runner-up. Thank you.
Ay, nadali. Di ba sudden the decrease in pressure is highest in arterials. Kasi sobrang taas ng pressure sa aorta tapos pababa siya hanggang sa pumunta sa capillary, sobrang baba na ng pressure. But the sudden drop or the biggest drop of pressure is in the arterials. Bakit?
Conductance, Doc.
High resistance
no.
capacity.
Okay, try to expand on that. You are probably near to. Correct yon. High resistance sa arterial. So, bakit bumaba yung pressure? Wala maisip. Okay, Cindy. Right. So, if the size of the arterial declines, the resistance will increase or decrease? Correct. So, if the resistance increase, bakit bumababa yung pressure? Blood pressure and area. Hindi. Ibang connect siya. Not on the BP. Just try harder. Ibang law naman. Try to use another law. College of Law. How about Ohm's law? Can you use that? The resistance now has increased. Ano yung Ohm's law? If the resistance increases, what happens to the pressure?
Inversely proportional.
It decreases because Ohm's law is inversely proportional. Pressure and the flow and is directly proportional to pressure but inversely proportional to resistance. So in arterials, because of our resistance, bababa yung pressure at saka yung flow. Okay? Mahirap ba?
Doc, again, Doc. Ano? Wala ka makuha.
Okay. In the arterials, the radius is decreased. Kasi compared sa aorta, mas malaki yung size ni. We're not talking about cross-sectional area. Huh? We're not talking about cross-sectional. We are talking about the radius of the aorta versus the radius of the arterial. Sino ba ang mas malaki? Siyempre, aorta. Mas maliit si arterial. We're talking about the radius of the lumen. Ha? So smaller si radius ng arterials. And by that, according to Poiseuille's equation, resistance is inversely proportional to radius. When the radius decreases, the resistance increases. Kasi powerful, in the Poiseuille's equation, the most powerful factor there is radius kasi to the fourth power siya. Every increase of radius by whatever centimeter, sobrang max, ano yun, pang to the fourth power yung effect to the resistance. Meaning, if the radius declines, the resistance will increase massively. And so because the size of the radius of the arterioles is smaller or has decreased, the resistance increased. Now let's use Ohm's law. Ohm's law says the flow is directly proportional to pressure, but inversely proportional to
resistance.
If the resistance increases, the flow and the pressure will decrease. If the resistance increases, the flow and the pressure decreases. And that's why there is that sudden drop of pressure in the arterial, because the size of the aorta versus the arterial, sobrang laki ng difference. Because in the arterials, the resistance is high, and when the resistance increases, the flow and the pressure also decreases according to Ohm's law. Hindi ko kasalanan yun. Si Ohms, Dr. Ohms kasi masyadong ginalingan. Okay na tayo?
Wait, Doc. So, an Ohm's law, Doc, is, ang gigamit is an radius hit lumen, tapos an Poiseuille, and cross-sectional dimension?
No. Poiseuille's law is radius.
Radius gap ratio.
Radius siya. So, in Poiseuille's law, you use the radius or yung radius ng lumen ba? So, if the radius of the artery is decreased, the resistance will increase. That's in Poiseuille's law. Now, in arterioles, because the radius is decreased, the resistance is increased. Kasi inversely proportional si resistance and size of radius in Poiseuille's equation. According to Poiseuille's equation, resistance increases when the radius decreases. So, in arterioles, since the radius is small, the resistance increases. Now, having known that the resistance is increased in arterioles, let's use Ohm's law. According to Ohm's law, when the resistance increases, the pressure and the flow also decreases. According to Ohm's law, if the resistance is increased, the flow and the pressure decreases. So in arterioles, the resistance is high, therefore the flow and the pressure is also decreased. Nakuha?
Confusing paguti, Doc.
Oh, tiwala lang. That's why I was trying to check if you have understood that. Because sometimes, ang bilis lang sabihin. Pero hindi ko alam kung na-pick up ng student. There are 3 types of students daw kasi. Merong 5 to 10%, like sobrang bilis ng pick up. Pero a large number of population, sabihin na natin 60% on the average lang. It takes time to understand. And then the remaining students medyo after 10 years pa maiintindihan. Kaya kailangan pa ulit-ulit lang siya. Okay? That question is neat. Yes! Cindy? Uh-huh. If the resistance will increase, what will happen to the flow? Correct. So in arterioles, the resistance is increased or decreased? In arterioles. Yes, so if the resistance increases, anong sabi sa Ohm's law? What will happen to the flow and the pressure? Right. At saka yung pressure. Will also... Wait lang, may tumatawag. Maria? Ayan, every time may natawag kasi nahina ito. Mga traitor. Ano na yun? Same deals, the resistance increase happen to the flow and the pressure. Pangit ba ang signal? Right. Correct. Decrease. Right. Right. So what will happen to the pressure?
Proportional. Tama.
Correct! Correct! Nakuha mo yun? Okay na tayo? Okay na? Correct yun, Cindy. Yay! Punta na tayo sa left. Okay. Oh, ito na. Meron pa akong question. How can you explain the rise of systolic BP in atherosclerotic aorta?
Ang resistance ada ito.
Yung question ko na ba ini?
Gary Doc, I was thinking out loud. Sorry.
Okay. How can you explain that? The systolic BP increases in our atherosclerotic aorta. Bakit tumataas yung BP? Baka na naman may chat. Ano? Hmm? Grade resistance increases kasi possessed law, the normal possessed law flow is directly proportional to radius and pressure. But if you derive that in terms of by mathematical derivation, resistance using the possessed equation, resistance is inversely proportional to radius and pressure. So paano tumataas si pressure in atherosclerotic aorta? Try to use other formula, not probably the possessed equation. But you are correct. The resistance increases there somehow in atherosclerotic aorta. But there is a rise in BP. You have to connect that to somewhere else. Think of capacitance.
Yes, Doc, it's about capacitance kasi when in atherosclerotic aorta, there is a hardening of the aorta, so there is less ability for the aorta to accommodate the increasing pressure. Amo ba?
Malapit na, pero nagdiretso ka lang. So the aorta is sclerotic, it does not expand, it's not compliant. Pero bakit tumataas ang pressure? Bakit tumataas ang pressure? Because
there is
the formula says that capacitance is directly or inversely proportional to pressure. Right. If the capacitance decreases, what will happen to the pressure? Correct. Ganun lang kasimple. Thank you for that wonderful wonderful question. In atherosclerotic aorta, the capacitance decreases according to the formula. Capacitance is inversely increases. And I thank you. Okay pa bang signal?
Okay pan signal, Dok, pero tamutok, diri pa good.
It will take time. It will take time. Okay. Let's go to the lecture. Wag, lalabas yun sa exam. Baka masyado mo na siyang makukuha.
Dok, para pasar kami tanan.
Basta, capacitance lang. Nandun lang siya. Wag niyo capacitance after this lecture. Okay?